Good morning. So I'm sorry I haven't done one of these for ages, been busy. So today we're going to do a knee mobility. So this is good for people who are doing loads of squats and their quads ache, but it's really good for people who've got arthritis in their knee or knee complaints, although I'd be really careful if you've got meniscus injury, because meniscus injuries tend to not like your knee twisting and moving. So, but arthritis, it's good to get your knee moving and to relax the muscles around that reduces the strain across the joint. So we're going to work on quads, hamstrings, tensor fascial lata or TFL, which is a muscle that affects the ITB down the outside of the knee. This is good as well for people who get ITB syndrome or pain when they're running. So we're going to start with the quad. I'm only going to do one leg, so you might want to stop the video or you can go through it again at the end. So we've got a ball. Oh, sorry, I should remind you of the things that we need. So you'll need a chair, you'll need a ball that we used before. This could be a tennis ball, lacrosse ball, anything like that. You'll also need some sort of band. I haven't got anything here, so I'm just using an ordinary scarf and a towel that you can put behind your knee, but you can collect these things as you go along. So to start with, we're just going to work on the quads. So quads are made up of 4 muscles. Two are on top of one another, and they've got the front of your thigh here. One is to the outside and one is to the inside. And when we do stretching, we rarely work on all 4, we just stretch the middle bit. So it's quite good to work on all 4 muscles. So you're going to place the ball, your kneecap's here, and you're just going to place the ball above your kneecap. And turn your leg over, and you're just going to lie face down. And you can start by just turning your knee backwards and forwards over the ball. As always with all the mobility stuff, it's usually pretty painful, but it's just uncomfortable type pain as opposed to a stabbing acute pain. If you have that, then obviously stop. So this is working over the middle quads that we just talked about, and it's just easing them off. All 4 quads converge into your kneecap, so this is the place where you get a lot of tension. So just turning your leg from side to side. When you feel brave, you can lift your leg up and down. So you're starting to do what's called soft tissue release. So you're getting a little stretch on your muscle, but the ball is in place to block it, which means that you're just stretching around your kneecap here. So this is just working on the middle muscles, as I was saying. So what we can do to change this is, at the moment, my foot is just coming towards the same cheek of my bottom. If we change and rock the ball out to the side, our leg crosses the other one, and this time, you are just taking your heel of your foot towards the opposite cheek of your bottom. And this is working on the quad on the inside of your thigh. This is called vastus medialis, and it can be a problem for a lot of people, especially if you have poor kneecap tracking. Although having said that, this is usually the muscle that's not working so hard. It's lateralis on the outside that's the problem in knee tracking. So you're just moving backwards and forwards, kicking the opposite knee. Then you can change the opposite direction, so the ball is on the outside of your leg and you're bringing your foot up towards the outside of your hip. Lateralis is the one that tends to get really tight on people. So just moving the foot out to the outside. So any of these movements, stick on a point that's painful for you, so, or more beneficial to you. So you can also bend your knee, and this time when you roll your leg, the ball rolls right across the top of your kneecap, so it goes through all of the quad muscles. So it's worth spending, if you've got knee pain, it's worth spending some time on around the kneecap. If you've got quad pain, then you may want to work further up your thigh. So I've just moved the ball to further up towards the middle of my thigh. And again, just drop your hip, you're balanced on your toes, and just drop your foot from side to side. This is moving your hip and the ball is moving across your quads. It's almost like giving yourself a massage. So this is releasing the muscle and releasing the fascia around the muscle. And when you feel brave, just kicking your backside. It's too hard as you get higher up your thigh to actually do the outside and the inside of your quad, so we're just sticking to the middle. So you can also scoot up and down, so just using your feet you can scoot up and down and work through the thigh. And you can just keep moving all the way up your thigh. Oh, my thighs are really unhappy today, I don't know why I'm doing it. I've done a lot of running and a lot of squats in this time at home. So just kicking, keeping your leg in the air and just rolling your leg from side to side. And you can move and work the ball all the way up to the front of your thigh. And once you've released that leg, we're going to do a quad stretch. So I'll use the chair here. So I can show you side on, because otherwise I'd have my foot against the wall, but you can put your foot against the wall. So what you're going to do is it's called a couch stretch because you do it against a couch, or you can do. So your foot is balanced on the chair. The further forward your knee is away from the couch, the less the stretch will be. The further towards the chair your knee is, and the more upright your shin is, the bigger the stretch will be. So we'll go midway. So you're going to bring your other foot up so that you're in an upright position. Now some of you might feel a quad stretch in this position, but what you need to do is two different things. One, you can move your body back towards your foot, so your bottom is going towards your heel, and that will get your quads more. If you go forward but squeeze your glutes and push your hips forward, you'll find that it becomes more of a hip flexor stretch, which is no bad thing. So you can go between the two. So keeping your body upright and your bottom towards your heel, or moving slightly forward but squeezing your glutes, pushing your pelvis forward, and this will move the stretch higher up your quads, more into your hip flexors. And with all stretches that we do, you want to hold them for 30 seconds. But after 15 seconds, take a nice deep breath in, and as you breathe out, move into the stretch a little bit more. Okay, so that's all the work that we're going to do on the front of your thigh. Now we're going to do some work on your hamstrings. We've done some of these before in other videos. So you're going to put the ball, can't believe I'm showing everybody my backside, but along the cheek of the smile line of your bottom. So the ball will be about here. You're sitting back on the chair and you're just kind of twerking really, just moving your bottom from side to side. If you're on the right place, you'll feel as though there's a bone that you're actually moving over. So you're just wiggling your bottom from side to side, and this is the origin of your hamstring muscles. And you know, this does get tight. Some people can get tendinitis here, or tendinopathy, and if you've been doing lots of deadlifts, this will be an uncomfortable area. So you're just wiggling from side to side to release that hamstring tendon. So the more you lean forward, with a flat back, not rounding your back off, that doesn't work. So with a flat back, the more you lean forward, the more tension you put on your hamstrings, so the bigger the stretch will be. So in this position, we're blocking the hamstring and there will be a soft tissue release. So you're just going to extend your leg. And this gives a better stretch than just doing a hamstring stretch. So as I say, the more you put your chest forward, your chest towards your thigh, the bigger the stretch will be. If you get to this point and your leg is straight, shaking, then actually just sit back a bit and take the tension off a little bit. Okay, and that's just releasing the top of your hamstring, but obviously your hamstrings go right down to the back of your knee. So you're going to move the ball to mid-hamstring, so this is of my thigh here. And once again, drop your back forward if you feel you need to, and you can see it's harder for me to straighten my leg because there's much more tension. So it's fine at this stage for me. Doesn't matter if you don't completely straighten your leg, but if you're shaking, if this brings on a shake in your leg, then you need to sit back a bit more, and then it won't be such a big stretch. So you can straighten and extend your leg, but also you can rock your leg from side to side, and that will get some movement through the, more massagey type movement through the hamstring. And then lastly, we'll just move down one more time. Don't go too far to the back of the knee, because there are lots of structures behind your knee that are too sensitive for us to ram a ball into it. But the hamstrings separate here, and they go to each side of your leg. So the little stringy bits that you feel behind your knee, they're your hamstring tendons. So putting the ball, if you go too low, you just miss the hamstrings anyway. And exactly the same. So the more you bend forward, the worse the stretch, the better the stretch will be, maybe more painful. So again, no shaking, come upright if you are, move your leg from side to side to release the tendon. If you do have a peanut, which is two balls stuck together, you can actually go behind your knee here. But I haven't got a peanut. Well, most of you won't have a peanut, so I'm not going to demonstrate that. So this is just releasing your hamstrings. Then, again, you make sure you do both legs. Mind you, if you've got one knee problem, there's no reason why you can't just do one. So I'm going to use, I'm going to use the scarf here. So the scarf is going around the ball, not across the ball of your foot, otherwise it makes it sciatica stretch. So just across the arch of your foot here. And you're pulling this leg, the other leg is straight, you're pulling the scarf so that your thigh is coming towards your knee. It doesn't matter that your knee is bent at this stage. So then you're holding the scarf to hold it in this position. Trying to keep that same amount of tension, you're just going to push your heel towards the ceiling. You can push and hold, but it's not necessarily beneficial. This is what they call a dynamic stretch. So it's a stretch with movement. So just pushing your heel up, holding it for a few seconds, and relaxing. So the aim isn't to be moving your thigh away from your chest. It's to keep your leg there and push your heel up towards the ceiling. And you'll find that when you're in this position, the stretch is down at the bottom of your hamstring. As you push your foot up to the ceiling, the stretch will start to move to the top, towards behind your knee. So it means that we're just stretching the whole of the hamstring, as opposed to just the part that's the most flexible anyway. So you want to do about 20 of these on each leg. If you didn't do any of the mobility, that's a good stretch to do prior to doing any workout. So the next one, this one hurts. So we have what are called adductors. They're muscles up the inside of your thigh here, and they run, so the big fat part of your knee here is bone, and as it starts to go in, this becomes the attachment point for your adductors. So this is where we're aiming to put the ball. And you're going to lay face down, other leg extended, and this leg straight out to the side. You will want your hips flat to the ground, but for now I'm just demonstrating. So you're going to put that ball in the point that I just spoke to you about, and turn your hips so they're as much as possible facing towards the ground. And you're just going to scoop your hips backwards and forwards to release the main adductor muscle. If you're feeling really brave, you can extend and bend this leg, but it hurts. But it does get a nice stretch on the adductor if you can do that. The other thing you can do is lift and lower your lower leg. And that again just rocks the adductor over the ball to release, or will massage the adductor. You can move along a bit and do exactly the same, scooting through the muscle backwards and forwards. You can lift and lower, or extend and bend this leg. So don't feel as though you need to work on all the bits. I mean, work on all the bits that I'm suggesting, but if you know you've got a particular tight area, then work on it a bit more. So don't stick to the time schedules. I'm just demonstrating here and trying not to make the video too long. So work up as high as you can. Eventually your hip will be too high and you'll start to lose the traction on the ball. So that's the point at which you stop. So that's working through the adductors. Then we need to stretch them. So we'll just do an easy frog stretch. So legs as wide as they can be. Doesn't matter whether your legs are out or in, doesn't make any difference. All you're doing is keeping a flat back and pushing your hips backwards until you feel the stretch up the insides of your thigh. And you're going to hold this position, take a nice deep breath in, and as you breathe out, just push back into that stretch a little bit more. If you don't feel the stretch, just widen and drop into your knees a bit more. And if you can't get into this position and you're only in this position, and push your hips back, if you can feel the stretch, then it's a good stretch for you. Right. No, I don't think we'll do that. Right, then we're going to put the ball into tensor fascia lata. So you have a bone on your hip here, and you have a bone in your hip here. Tensor fascia lata is this meaty bit in between, and that's where we're aiming to put the ball. So you are side lying, so the top leg is bent over to relieve some of the pressure, and the ball is under this hip here. And all you're going to do is scoot backwards and forwards. You can also rock your hips backwards and forwards to release that muscle. If you are feeling really brave, you can move this leg out of the way and you can bring your thigh up and down, and you'll feel the ball digging in to tensor fascia lata, or TFL. And this is more of a trigger point thing to do, and it releases the muscle off, but it can be really painful. So any of these movements, backwards and forwards, over, scooting up and down, or lifting your thigh up and down. And you really want to work on these areas about 2 minutes to get maximum effect. But you know, anything you can manage is got to be good. So then we're going to stretch it, don't know which way around, to demonstrate this. So you're lying on your back and you're going to drop both knees to one side, and you're going to lift your bottom foot, put it over your top knee, and use it to pull your top knee downwards. And you should feel this stretch up the outside of your thigh here. And as with all stretches, you're going to take a nice deep breath in after 15 seconds, and as you breathe out, just press down with your foot onto that top leg a bit more. So this is really good for runners. Runners often get tight tensor fascia lata. Okay, and then the last thing we're going to do, and see how it feels to you. Some people don't like it, other people really like it. So this is a normal hand towel. I've just folded it and then rolling it up. This is called a gapping technique. So what you're doing is putting this towel behind your knee and then just sitting back on the knee. And what's actually happening at this stage is the towel is acting as a fulcrum, and so your your femur at the top and your tibia at the bottom are actually being pulled apart. So it gives a little stretch on the joint capsule, but it also just separates the fibres and allows some more synovial fluid into the joint, which is helpful for people who've got arthritis. So if you can sit there for 30 seconds to a minute, that will relieve some tension around the knee if you've got knee pain. Okay, that's all we're going to do for today. Hopefully it'll be useful to you, and I'll see you again with another mobility. Take care, bye.